In 2007, 12,280 women were diagnosed with cervical cancer. Of those 12,000, 4,021 women died. Cervical cancer used to be the leading cause of death in women, but in the past 40 years, the number of cases and deaths have decreased. I became interested in cervical cancer when I was recently diagnosed with moderate dysplasia. Basically, all that means is that if left untreated, I could develop cervical cancer in a few years. Today, I would like to discuss with you the causes, treatments, and prevention of cervical cancer. Cervical cancer is a disease in which malignant cells affect the cervix right below the uterus, which is right here. The most important risk factor for cervical cancer is the human papillomavirus, or HPV. The HPV is made up of a group of more than 100 related viruses that can infect the cells of the surface of the skin, but not all types of HPV can cause cancer. But the kinds that do are called high-risk HPVs. HPV is spread by skin-to-skin contact, but you must come in contact with the infected area. Many women that have HPV don't develop cervical cancer, but some do. Some other risk factors for cervical cancer are smoking, weakened immune system, diet, birth control pills, and young age at the time of first full-term pregnancy. Women who smoke are twice as likely to develop cervical cancer than women who don't. It is also important to keep a healthy diet. Diets that are low in fruits and vegetables are linked to an increased risk of cervical cancer. Birth control has shown to cause an increase in risk of cervical cancer. Research suggests that the longer that a woman is on birth control or taking the pill, she has a higher risk, but once she stops taking the pill, that risk will lower. Now that I have talked about some of the causes of cervical cancer, it's time to talk about treatment and options. There are 3 standard types of treatment. The treatment options depend on stage of the cancer, size of the tumor, the patient's desire to have kids, and the patient's age. There are many types of surgeries, including conization, which is where a cone-shaped piece of tissue is removed from the cervix and the cervical canal. There's also a cryosurgery, which is where an instrument is used to freeze and destroy abnormal tissue. There's also the loop electrosurgical excision procedure, also called LEEP. In this procedure, there is an electrical current passed through a thin wire loop as a knife to remove abnormal tissue or cancer. You can also have a hysterectomy. You can have a total hysterectomy, which is where the uterus and the cervix is removed, which is this part. Or you can have a radical hysterectomy, which is where the cervix, uterus, part of the vagina, and then some of the major ligaments and tissues are also removed. Some other types of treatment are like radiation therapies. There's 2 types of radiation therapy. Radiation therapy uses high-energy X-rays or other types of radiation to kill cancer cells. The 2 types are external and internal. The external uses a machine outside the body to send radiation towards the cancer. Internal uses radioactive substance sealed in needles, seeds, wires, or catheters that are placed directly into or near the cancer. Chemotherapy is another type of treatment. Chemotherapy is a treatment that uses drugs to stop the cancer or the growing of cancer cells. There are 2 types of chemotherapy also, systemic and regional. Systemic is where drugs enter the bloodstream and travel throughout the body to reach cancer cells. The regional therapy is where drugs are placed directly into a cerebrospinal fluid, an organ, or a body cavity. I will now focus on ways to prevent cancer so that hopefully you or someone that you know will never have to go through a treatment. One of the main ways to prevent from getting cervical cancer is to avoid being exposed to HPV. A few ways to do that is wait until you are older to have sex. If you don't wait, you can limit the number of sex partners you have or avoid having sex with someone who has had a lot of sex partners. Another way to prevent cervical cancer is not to smoke. Like I said earlier, women who smoke are twice as likely to get cervical cancer over those who don't. Another way is to get vaccinated. There are two types of vaccinations that have been studied and approved by the U.S., and those are Gardasil and Cervarix. Both of these require 3 injections over a 6-month time period. Even if you do everything you can to prevent cervical cancer, you still might possibly get it. One of the ways to make sure that you don't get it is by getting a pap smear. A pap smear is where the doctor collects cells from the surface of the cervix and vagina. They use a piece of cotton, a brush, a small wooden stick, and they gently scrape cells from the cervix and the vagina, which they'll come in right here and they'll scrape all the way down into the cervix. After they collect the cells, they will go and view them under a microscope and determine if they're abnormal or not. If they do come back abnormal, they usually will send you to an OB/GYN to have it looked at further, which is where you might have a biopsy done. My purpose for this speech has been to educate you on the causes, treatments, and preventions for cervical cancer. Every woman should be aware of the dangers of cervical cancer. It's never too early or too late to begin preventing cervical cancer. Thank you.